to another episode of the podcast. So on the podcast today, we're going to be talking about 3 supplements in particular that I think we have to be more aware of, that I think we have to be more judicious of, that I think you as somebody who is listening to this podcast because you care about your health and you advocate for yourself, that you need to be aware of, because you probably will come along a practitioner, a naturopath, a nutritionist, a functional medicine doctor who will recommend one or more of these supplements to you. And you have to stop and think, is it really right for your body? Because let me tell you, vitamins and minerals are not benign, okay? They are not safe blanketly. And if you are taking these supplements without knowing if you truly need them, you can do more harm than good. You can do quite a lot of harm actually to your body. So that's why I speak out again about these supplements. I am not saying nobody needs any of these supplements. I have never said that, and I would never say that because that's so arrogant, right? And what a silly thing to say. But I am saying I think that they're being given out like candy. And I think that even doctors, like there are so many medical doctors out there, most of them truly, because I work with a lot of clients, and I listen to doctors on podcasts and I see what people are writing on social media. And a lot of doctors are recommending these things quite blanketly without doing testing, just because. And I think it's just very dangerous, and I think we need to be smarter than that. There is one particular doctor who touts herself as a thyroid expert. She's written books, and she has actually blanketly said that you don't need to test for a couple of these supplements, that giving it can do no harm. Wrong, 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 wrong. So let's get into it. We're going to talk about vitamin D, iron, and selenium. And again, I have spoken about these before, but there's a lot of new people that come into my world every day, so we want to keep the conversation going. So let's start with the vitamin D, the magic cure-all, the miracle vitamin that's actually a hormone that everyone and their dog are taking. Yet, weirdly, since this particular vitamin, whatever you want to call it, hormone vitamin, since it is a miracle and it fixes everything, why then, with so many people taking copious amounts of this, are chronic disease states on the rise? Why isn't this miracle cure-all curing everything, right? Sorry to be sarcastic, but we really have to think critically. And I just don't think there's enough people in the field thinking critically, including medical doctors. So, again, I've never said that absolutely nobody needs D, but I cannot tell you the last time I personally recommended it to any one of my clients. So yes, your needs are going to vary based on your location, your ethnicity, but please don't make the mistake, which a lot of my clients do, thinking, for example, I live in Canada, I need D. Do not think like that. That's the kind of thinking that's going to get you into trouble. That is black and white thinking. And nothing in health and wellness and the human body is ever black and white. There are all shades of gray. You got to think more critically than that. So just because you live in a climate where there's not a lot of sunlight does not automatically mean you absolutely need D and you can do no harm by taking it. And off the bat, let me tell you, 2,000 IUs a day is a lot of D. Don't even get me started on the 5,000, the 7,000, the 10,000. That's really scary to me. But, of course, work with a practitioner who understands vitamin D and who can look at your bloods and make an accurate assessment, and look at your minerals too, because your minerals are going to impact your vitamin D status, okay? It's not just about D and D alone. What's your calcium doing? What's your magnesium doing? These things are imperative to make you be able to utilize and metabolize D effectively. So here are my concerns in a nutshell about vitamin D. So the idea that vitamin D actually causes disease, causes autoimmune disease, causes inflammation, or whatever disease you want to say it causes, because at this point, if you go online and listen to some social media influencers, you're going to be told that vitamin D deficiency causes everything. So the idea that low vitamin D causes disease, that has not been established in the research, and that might actually shock you, because you're not hearing that, are you? You're hearing the opposite. But it's not been established in the literature. or any literature for the causation of disease due to low vitamin D is very, very weak. So more likely what we're seeing in the research is that inflammation and other infections and disease states are the culprit of low vitamin D, not the flip side. Okay. And again, like, wouldn't we see so many more diseases getting better if the sole cause was low vitamin D? It's just nonsensical, right? With the amount of widespread supplementation of D, we would expect to see a lot of these chronic illnesses getting better, inflammatory diseases getting better, but we're not. This vitamin D, this era of high dose or even just supplementing vitamin D is not solving the issue. So it's very unclear at the moment about deficiency guidelines. So the guidelines about how much vitamin D you must have in your body to be sufficient versus insufficient, it's not clear. Same thing for supplementation. There are no clear guidelines established. So what we know from the research is even those people who have a really good amount of sun exposure can be classified as deficient. And this really makes little sense, and it does encourage over-supplementation. I just quickly paused the recording because I wanted to read something out to you guys that I had written. I was having a chit chat with a colleague and I just thought I would read this out to you. So what I said to this colleague was reference ranges for D may be set way too high. So according to about 200 odd research papers, this was actually a mentor of mine went through these research papers and came up with a reference range that is significantly lower. I'm not going to say what it is. I use that reference range, but I'm not going to say what it is because there's many reasons why, but I have a significantly lower reference range for vitamin D than what you're going to find on your lab's reference range, and significantly lower than what many functional medicine experts out there are suggesting. And yet there's so many different definitions of vitamin D deficiency. So I'm actually going to read some of this out to you. So the Institute of Medicine suggests that reports of deficiency in lab ranges may be skewed and overestimated because no central authority has determined which cutoff points to use. So here are some definitions of vitamin D levels from sources that I have. So Vitamin D Council says you're deficient at 0 to 40 nanograms per milliliter, and you're sufficient at 40 to 80, and high normals 80 to 100. The Endocrine Society says deficiency is under 20, insufficiency is 20 to 29. The Institute of Medicine says deficiency under 12, risk insufficiency 12 to 20, sufficient 20. Merck Manual, normal is 25 to 40. Quest Diagnostics, upper limit of normal as 100. And you're going to find some practitioners out there suggesting you have to be way over 100 in your 25 OHD levels. So that's just food for thought there. So we've got these unclear deficiency guidelines, and we also know from research that there's a lot of healthy individuals. They're very healthy. They haven't got any diseases, but they have these, quote, low levels of 25-OH. So we've also got this risk of immune suppression. So what a lot of people don't realize about vitamin D is that it can suppress the immune system, and this actually it can act like a bit of an immunosuppressant, and this actually can be beneficial at first, right? So if you've got these inflammatory symptoms, you come and you dampen that fire with some vitamin D, you might feel really good all of a sudden and then start to tout the miracle benefits of vitamin D. But, this could be problematic long term, and it can especially be problematic if someone has chronic infections to be suppressing that immune system. So yes, you might get some symptomatic relief from D, but there could be a significant cost to long-term immune suppression. So we need to keep that in mind. And then we have the issue of proper testing. So you're never going to get both vitamin D tests done unless you ask for them. And those are, you've got 25-OHD and you've got 125-OHD. And you really want to get the two of these done because that's going to tell you a lot more about your vitamin D metabolism. And, it may indicate this dysregulation of vitamin D. And this can often be linked to inflammation. This is often, like, for example, 125-OH is usually quite elevated. It definitely can be used as a marker for inflammation because it's quite elevated oftentimes in autoimmune diseases like Crohn's. So a lot of things to consider. There is also talk about how little amount of sunlight you really do need to synthesize vitamin D. So, yes, it's going to depend where you live and your ethnicity, of course, but only 10 to 15 minutes of sunlight exposure on a small area of skin twice a week in this one study provided enough vitamin D. So, I'm not saying that's all you need necessarily. I think we should all be getting outside every single day and getting that vitamin D exposure, even in the cooler weather. But, studies have shown that even in urban areas with high pollution, 50% of UV rays can still reach the Earth's surface, and over 90% of UV rays may penetrate clouds. So, environmental factors are rarely an impediment to the photosynthesis of vitamin D, right? Of course, melanin pigmentation is a factor to consider, definitely. Um, so yeah, a lot of things to consider. So I just think that the prevailing dogma that we have this low epidemic of low vitamin D may not be accurate. And we might want to be really, really judicious and careful when it comes to our vitamin D. So what is my suggestion for you? My suggestion is make sure you're working with somebody who questions everything, and make sure that you're working with somebody who does not suggest I don't think anyone likely needs very, very high dosages, but somebody who understands the importance of testing 125 and 25. That's probably one of the key sort of red flags. And you can chat to them about this when you suggest vitamin D, or what are your thoughts on vitamin D? And if they say it's wonderful, it's amazing, most people are deficient, we should be supplementing, well, you got a red flag there. If they say, well, some people might need it, but it really depends. And, I like to test both levels. Ding, ding, ding. This person is thinking critically. Okay. Okay. So let's talk about iron. So iron can be very, very dangerous in the body. You may have heard of a condition called hemochromatosis, and that is essentially when you, rust from the inside out, sort of. It's very dangerous to have too much iron in the body. So what I hear a lot, again, in the online functional medicine space is that women are deficient in iron. There's so many women deficient in iron. I am not sure this is true. I don't think it's, again, that easy, that black and white. And ferritin is not a good marker for iron deficiency in the body. So I think what we're dealing with is more of an iron metabolism issue, not just a deficiency of iron, especially this day and age when a lot of women, especially in my community anyway, are very cognizant of eating red meat and of not eating plant-based, right? So if you're not eating plant-based, you're eating red meat a few times a week, the chances of you being iron deficient are probably pretty slim. Maybe if you have really, 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 really heavy periods, there could be something there to be addressed. And again, we always have to look at the person, the individual, and look at their blood markers, but more than one, right? So you need to work with somebody who truly understands blood work. It is nuanced. And a lot of doctors still, I don't care if you've got MD after your name. It does not automatically make you somebody who knows what they're talking about. So if your doctor is looking at your ferritin alone and based on your ferritin telling you that you have an iron deficiency, then run, okay? There's lots of things we need to look at. We can look at hematocrit, we can look at hemoglobin, we can look at soluble transferrin receptor is the gold standard, which nobody tests ever. But I would never suggest iron to a lady unless I had soluble transferrin receptor. I personally like to look at ferritin combined with soluble transferrin receptor. Then I do a fancy log ratio as well. And if it's beyond a certain ratio, then that might suggest iron deficiency anemia. Even if ferritin, however, that log ratio that I have calculated for my ladies who get both ferritin and soluble transferrin receptor done, I can't even remember the last time I saw that ratio high and above the level that would suggest iron deficiency anemia, even when they have low ferritin, meaning they don't have an iron deficiency. they have an iron metabolism issue potentially. Now, iron gets very, very, very complex, and I will not pretend to understand iron even half as much as we could, because I don't think you'll find a person on the planet who understands iron. It is crazy complex, crazy complex. I have very smart mentors who tried to dive into iron, and they were just like, it is a really complex mineral. So that's why I think we don't want to play. We don't want to play with things we're really not too familiar with yet as the, the humans that we are. So what we do know, though, ferritin is not the gold standard. It's just one marker. It does not give the full picture. We love soluble transferrin receptor. We love a log ratio, but we need to be thinking about metabolism of iron, not just low ferritin must supplement iron. That can cause issues, especially if there is this backlog, this issue with iron metabolism. So anemia of chronic disease is what has to step in here. So anemia of chronic disease, also called anemia of inflammation, is essentially not a low iron picture. It's an iron metabolism issue. It's when we've got this chronic inflammation or chronic infections at play that are causing iron to be metabolized in a way that is making it less bioavailable. So we need to fix that metabolism. We need to fix the inflammation. We need to go after the infections. We need to ensure that we've got enough copper. Copper is huge when it comes to iron metabolism in the body. So we need to, again, it comes back to these minerals, doesn't it? Just like with vitamin D, you got to look at your minerals. Well, iron's the same. You got to look at your whole mineral picture. Again, do an HTMA. These HTMAs will not fail you. It's why I continue to use these tests in my practice. But if you don't balance that copper with that iron, you're going to end up having an iron metabolism issue. So you're just throwing iron at the body is not the solution. So I also want to touch on how vitamin D plays a role when it comes to iron. So all these people taking vitamin D because they've been told your 25 OHD is low. So let's take vitamin D. Let's take all this supplemental D to try to increase your levels. Well, you could actually be countering what the body is trying to do on purpose. The body is way smarter than we are. And so when we bring on board these supplements, we're tinkering with what the body might be trying to do. So let's say that the body is trying to lower your iron because you have an infection, and iron is like chocolate to bacteria, as one of the studies said. Iron will feed infections. And that's one of the reasons why the metabolism of iron will change when you have a chronic infection. That's your body trying to protect you. It's a little like TPO antibodies. They're not always bad. When we get these thyroid antibodies, it doesn't automatically mean your thyroid is failing. You don't even have to have hypothyroidism when you have antibodies. But your body does these things as a protective mechanism. So it's trying to hide this iron away from the infections in your body. You come along because one of your well-meaning nutritionists or functional medicine doctors or anyone has told you to take vitamin D to try to get this one level up because you haven't looked at the both of them. And all of a sudden you're pushing up 125 OHD as well, that D marker that no one tested in you. And when you do this, you're going to reduce something called hepcidin or hepcidin, depending on who you speak to. And what this will do is make iron more available in the body. So here's your body trying to lower iron so that it doesn't feed infections, feed inflammation, and you come along and douse yourself in vitamin D, which changes things and increases the iron exposure to the body, which the infections and inflammation gobble up. You're countering that protective mechanism. So just another word of caution with vitamin D. So back to iron, it's probably an iron metabolism issue. We want to think about things like vitamin A. We want to think about things like copper. Yes, you want to think about things like your gut health, your absorption. Are you eating enough red meat? Tick all those things off and do those things first before getting an iron infusion, before taking iron, in my opinion. You got to go for the root, support the body before trying to douse it in something just to move a blood marker, a ferritin, which isn't even a good marker for iron deficiency as it is. You could make things a lot worse. All right. So caution with iron. Maybe what you do is take beef liver. I don't have an issue with beef liver. Again, I think you should be testing your HTMAs, your hair tissue mineral analysis. I do think you should do an HTMA. Best case scenario would be a couple of times a year, and keep abreast of what all your minerals are doing, including your copper. But yeah, you could take beef liver because it's going to be much safer because it is a food form of iron. All right, and the last one we're going to talk about is selenium. Good old selenium. So I've spoken out about selenium before as well. And I think this one is really important because you have so many doctors out there, or naturopaths, saying that everyone with a thyroid issue needs selenium. And there's one particular doctor who actually says that you can do no harm by supplementing selenium and you don't need to test. That were her exact words. You don't need to test selenium, just take it. If you have a thyroid issue, just take it. And she was basing some of this on some research on selenium lowering TPO antibodies, but that selenium was actually pretty damn poor, to be honest. So when it comes to selenium, often recommended for hair loss or thyroid issues. What I see in practice, 9 times out of 10, is excess selenium. So I like to test in blood and hair. And the hair I take with a bit of a grain of salt, but I let it just inform my overall decisions. But I always push my ladies to get selenium done in blood. And I highly encourage you to get your selenium done in blood. And when I see selenium, 9 times out of 10, it is high. It is high. And this is problematic because selenium toxicity is a very real thing. I've spoken to my very own doctor about this. She has seen this in practice. I believe I have seen this in practice. So selenium toxicity looks like hair loss. So funny, hey? We're being told to take it for our thyroid because maybe we've got hair loss and our thyroid might be struggling, or we're told to take it for hair loss. A lot of hair loss combo supplements. Stay away from all combo supplements. Never go DIY your supplements. One, never go grab a combo supplement. Two, but these hair loss combo supplements, a lot of them have selenium. But the hilarious thing is, which is not so funny, is that selenium toxicity, which is not as uncommon as you think, can lead to hair loss. So if you have selenosis, is what we call selenium toxicity, then you might have hair loss, garlicky breath, a metallic taste in your mouth. You might have fatigue, nausea, nervous system issues, irritability. You might have a rash. You might have skin issues. So these are the things to think about. Has that been occurring for you since you've started to load up on selenium or take a selenium-based, a combo supplement with selenium? Or are you eating a lot of Brazil nuts? You'll be very careful with Brazil nuts. They are very, very high in selenium. And yes, it depends which part of the world they're grown in, but it can range from 50 micrograms to 100 micrograms. That's a lot of selenium. And I was just talking to a friend actually today, and she's got quite significant hypothyroidism. And she was told to eat 5 Brazil nuts. And I've not seen her selenium in blood yet, but I'm sure it would be high. And so I said to her, just cut that back to 1, especially until you see selenium in blood. Now, why do we have to be so concerned? Well, research shows that selenium at a level of 122 or higher, which is common, if that is your blood level range, you should not supplement because this can increase the risk of selenosis, which I just spoke about, but also cancer and diabetes. You don't want to play with these vitamins and minerals as if they can do no harm. They can. They can. Now, mercury toxicity is a bit of an exception. We do know that there is this interplay between mercury and selenium. And so if you've got high mercury, again, another ding, ding, ding to go and get that HTMA done, come to us. We can help you with doing an HTMA. So reach out and or book in for a 30-minute consultation with me. And the link to that will always be in the show notes. And then we can have a little chit chat about your case and what the best course of action is for you. But we can run HTMAs for you. So if you run the HTMA, hair tissue mineral analysis, we get to see all your minerals, which you now know play a role in vitamin D, iron, and selenium. And we get to see your heavy metals as well. So if you have a mercury issue, that might be one reason why you've got high selenium in blood. And that could be okay, because selenium does help to neutralize that mercury, but you have to have a plan in place. You need to be working with a practitioner who knows how to help you clear that mercury. Um, so just be very, very cautious and look at your supplements and go to the kitchen, check and see, or wherever you have your supplements, and check and see all the things you're taking and add up the selenium. And then on top of that, are you eating Brazil nuts? Okay. Now, I know that a lot of you out there are thinking, oh, but I've heard from the thyroid experts in the online health space that selenium helps with the conversion of T4 to T3. But is this really the case? So, where did these thyroid experts get this from? Well, it's because the deodorinase enzymes, which are these enzymes that help the conversion of T4 inactive thyroid hormone to T3 active thyroid hormone, they are selenium dependent. But the funny thing is, again, that's not so funny, is that first of all, a lot of people aren't selenium deficient, but second of all, these deodorinase enzymes, they retain selenium at all costs. So studies show that even in cases of critical illnesses like cancer, the body actually retains selenium, and selenium levels are often sufficient even with cancer. So selenium deficiency, it very, very rarely impacts these enzymes. So I think somebody has come along, found in the research that we've got these diodinase enzymes and they help to convert, and they love selenium. So let's just supplement selenium because you must have an underconversion issue. If you've got high T4 and low T3, you must be underconverting, right? And that's not necessarily true either. Your practitioner needs to look at your thyroid panel in a more judicious way. So you could have something called non-thyroidal illness. I go into this in my course, HRT Made Simple, which has a whole thyroid module in it. So if you really want to dive in and understand thyroid better and make sure that your practitioner is giving you the right advice, that's the course for you. Again, that'll be in the show notes because I have this incredible, robust thyroid module and I talk about non-thyroidal illness. I talk about blood patterns for the thyroid, what you want to look for. I give you all that information. So again, you can be judicious about who you work with and the information you're reading online or the information that your doctors or your practitioners are giving you. Because low T3 is not necessarily a bad thing. Like I was saying, TPO antibodies or thyroid antibodies, they're not always a bad thing either. So be very careful with these people that do the black and white thinking. Diodinase enzymes convert T4 to T3. They like selenium. Give selenium for everybody with a thyroid issue. PPO antibodies or thyroid antibodies. Oh, you have a thyroid problem. Low T3, you have a conversion issue. That's none of those statements in and of themselves are definitively correct. So the body retains selenium at all costs, even when we've got cancer at play. The body really holds on to selenium. Why is that? Well, maybe it's because thyroid function is such a critical part of health that maybe the body recognizes that because the body's smarter than we are and really maintains that selenium at all costs. So bottom line with selenium, get your levels tested, do an HTMA, balance all your minerals, get your selenium tested in blood, be mindful of the hidden sources in your supplementation or your diet, and just be very mindful of what selenosis actually looks like. Brittle nails is another one. So hair loss, brittle nails, fatigue, nausea, irritability, skin rashes. There's a lot of people who have these things. So if this is you, I would stop the selenium supplementation because it's probably never going to do you harm. Just stop it and go and get it tested in blood and see what's going on. Okay. So I hope that that was helpful. And I just think we need to be more critical as practitioners. We need to really think critically. And who knows, maybe you do need D or iron or selenium, but maybe you don't. And I think, and my suspicion is that far too many people are using these things who do not need them and potentially keeping them ill, keeping them symptom riddled, or making things worse. So be careful. And again, if you want to find out more about thyroid health, and I go into iodine in great detail too, then grab my course, HRT Made Simple. The link for that will always be in the show notes. If you want to talk to me about your case, if you just want to have a chit chat with me for 30 minutes, you want me to look at your bloods or any functional tests you've done, I cannot do protocols. You're not a client. I can't give you advice, but you can book in for that call. And then we can chit chat about this. And then if you want to become a client, we can talk about how you can do that as well. So you'll find that link in the show notes. As always, I hope you enjoyed this episode. Share it out with your family and friends. Come find me on Instagram. I'm at Tarathorn Health. Make sure you're subscribed so you never miss an episode, and we will talk again soon. Bye for now. I am not a medical professional, and the information provided in this podcast is for informational and entertainment purposes only. I do not have access to your individual medical history or circumstances, so the content discussed here should not be considered as medical advice. Before making any changes to your diet, lifestyle, or considering the use of supplements, please consult with a qualified healthcare professional or your doctor to ensure it's safe and appropriate for your specific situation. Any decisions you make based on the content of this podcast are at your own discretion and risk. Thank you for tuning in.